Dr. Fauci. My name is Angela, and I'm so excited to kick off a new series for the We Think Twice community called Ask the Experts. To start us off, we're delighted to have you with us here today to discuss COVID-19 vaccinations. I'll ask the first question and then pass it along to my peers. My question for you is, how were you able to make the vaccine so quickly?
Well, that's a question, Angela, that gets asked very frequently. And the reason is that the research, the basic and clinical research that went into the development of a vaccine did not start on January of the year 2020, when we first heard about this new coronavirus, this novel coronavirus. Actually, the research began a couple of decades before. So when we heard and learned of the sequence of the virus, we were able within days to go ahead and start on the vaccine program. And within 65 days, we were actually in a phase 1 study. So what the result was is that it was less than 1 year. We started in January of 2020. And by the time we got to December of 2020, we already had a highly effective and safe vaccine going into the arms of people, which now, a year later or more, has actually saved millions of lives worldwide. So it really is a testimony to the importance of investment, years and years of investment in basic and clinical research. That's the reason why we were able to do it so quickly.
Thank you.
Hi, Dr. Fauci. My name's Tony, and my question pertains more to the demographic of teenagers. So I've heard that they don't seem to get sick if they get COVID. And I've heard a lot of people are, getting sick from COVID, even if they are vaccinated. So why should our demographic of youth need to get vaccinated with COVID, the COVID vaccines?
Well, Tony, you've asked the question. If you examine it, it's inherently contradictory, because you said that teenagers don't get sick, but when they get vaccinated, they do get sick. So why get vaccinated? So that's kind of an oxymoron. However, having said that, first of all, it's a misperception, Tony, that younger individuals, children and teenagers and adolescents don't get sick from COVID. Certainly, the statistics are that it is less likely for a person as young as you are to get seriously ill compared to someone as old as I am. There's no doubt about that the elderly and with underlying conditions clearly have a greater likelihood of getting severe disease. However, that does not mean that teenagers and adolescents and children are not also susceptible to getting sick. All you need to do is visit some of the pediatric hospitals throughout the world, and you will see plenty of young people who are seriously ill, some requiring intensive care. That's the first part. The second part, to say that some people who get vaccinated do get infected, therefore that's a reason not to get vaccinated, is a false narrative, because people who get vaccinated, who get a breakthrough infection, are much, much less likely to develop serious disease compared to someone who's infected but who isn't vaccinated. The data on that, Tony, are very, very clear.
Thank you.
You're welcome.
Hello, Dr. Fauci. My name is Samaya, and I was wondering, how often do you see us having to take the COVID-19 vaccine? And will it become a normal thing like the flu shot?
Samaya, I have to tell you, to be honest and transparent, we don't know the answer to that right now. We do know that if you take the mRNA vaccine and get a third shot boost, or if you took the J&J and get a second shot boost, that you can get a very high degree of immunity that lasts longer, likely, than just the 2 doses. We don't know how long it lasts. So it is conceivable that the durability will be extended well beyond that third dose. The only way to know that is to wait and see how long it lasts, because we've only been giving boosters for a relatively short period of time. We hope that you will not need a vaccine every year to stay protected, but we're just going to have to follow it very carefully and see if that's necessary. And if it is, we'll just have to adapt to that.
Thank you, doctor.
You're welcome. Thank you.
Hi, my name is Jasmine, and I'd like to know, does the COVID-19 vaccine have any negative effects on the reproductive health of youth?
Well, the answer to that one is easy, Jasmine. And the answer is no, because we have now literally billions of doses of vaccine have been distributed worldwide, over 6.6 or 6.8 million in the United States. So we really have really no concern at all that there's any negative impact on fertility or any other aspect of reproduction in any age.
Thank you.
You're welcome.
Hey, Dr. Fauci, my name is Martin, and some of my fellow youth would like to know, how could one convince their parents to let them get vaccinated?
That's a good question. And I think it's to try and develop a non-confrontative discussion and just go with the facts and explain to your parents, what is it that is making you hesitant? And I've sort of answered that question in some of your colleagues' questions to me. For example, do you think it's because it was developed so quickly? And then you explained that it wasn't really that quickly because the investment in research was a long time. Do you think it's not safe? Well, as I mentioned just a moment ago, we have now, about 400 million doses that have been given in the United States to a large number of people, over 180 million people who've received the vaccine in its full course. So if you think that that's not enough experience, that's a lot of experience, because as I mentioned just a moment ago, globally, there have been over 6 billion doses, and in the United States, over 400 million doses. So you've got to go question by question and answer it for your parents, and hopefully you'll win them over to realize why it's so important for their own health and the health of their family and society to go ahead and get vaccinated.
Thank you, doctor.
You're welcome. Thank you.
Hi, Dr. Fauci. My name is Scott, and I was curious. What would you say to people in general who are still afraid to get the vaccine?
Well, Scott, I would give them the same answer that I would have given to Martin's parents, and that is that let's go through the reasons why you are hesitant. And in a completely non-confrontative but instructive way, try and answer those questions. And they'll vary. They could be, you went too fast, we don't know about safety. There are some conspiratorial things, like if you get vaccinated, you become magnetic, or somebody will put a chip in the vaccine and follow you around. I mean, those things are almost ludicrous, but there are some things that are understandable. I mean, if people hear through the social media something that's completely untrue, that the vaccine has a negative impact on your fertility, which we know that that's just not the case, or it's bad for pregnant women to get vaccinated. In fact, it's very important for pregnant women to get vaccinated because the effect of COVID disease on pregnancy is very profoundly negative. So there's a good answer to all the questions. We just have to keep an open mind to answering those questions.
Thank you, sir.
You're welcome, Scott.
Hi again, Dr. Fauci. How long are antibodies effective after recovering from COVID-19? And if you have had COVID-19, do you really need to take the vaccine?
Well, antibodies that you can measure last for a few months, maybe 5, 6, 7 months. But that doesn't mean that the protection goes away, because you also have in your body what's called memory B cells, as well as T cells that can protect you even when you don't have a very high level of circulating antibody. So you should not feel that because that level goes down, that there's a profound degree of loss of protection. The reason that we say that people, even though they've been infected, should also get vaccinated, because unlike the response to vaccine, the response of immunity following infection is much less well-defined. It certainly is present. You don't want to deny that. There's a degree of protection, but it varies about related to the age of the person, the underlying condition, how serious their infection was. Was it an asymptomatic infection or was it a highly symptomatic infection? All of those things influence what the level of protection are. So that's one of the reasons why, in order to get rid of that uncertainty, the CDC recommends that even if you have been infected, you get vaccinated, because the one thing we know is true is that vaccination following infection increases dramatically the level of protection of an individual.
Thank you, doctor.
You're welcome.
Hello again. My question as a student is, how do you think we can support vaccine promotion through our education systems?
Well, I think the education system is really one of the most critical venues to do education about vaccine, because you have people in a setting where the purpose is of learning and learning the truth, learning facts, learning evidence. And I think that that's a very opportune time to get all of the questions, which are valid questions, get them asked and answered by an authority who does have a command of the facts and the evidence. So bottom line, it's a very good venue to be promoting the truth about vaccines.
Thank you.
You're welcome.
That wraps up our first Ask the Expert session. This has been an informative discussion, and we thank you, Dr. Fauci, for taking the time to answer our questions. Also, thanks to the We Think Twice community for listening in. Stay tuned for our next Ask the Expert IG Live. Be safe, and we encourage all of you listening today to go get vaccinated.
Thank you, Jasmine. It's been great being with you. Thank you for having me.